chronic wounds can last for years and left untreated can lead to amputations. About 200,000 amputations happen every year in the U.S. and in Pennsylvania, the rate is higher than average. The new director of UPMC's McGowan Institute for Regenerative Medicine, Dr. Chandan Sen, is hoping to change that. Thank you so much for being here today.
Thank you for having me.
I know you're very busy, so it means a lot that you can be here to talk about this. And let's start at the very basics about what a chronic wound is.
Any wound that is open for more than 4 weeks or a month is a chronic wound. And typically, these then get complicated by infection. So it's different from an acute wound.
And what can this stem from? I mean, when someone has a chronic wound, I mean, does it start out with someone thinking this is just going to heal, or is this coming from a bigger issue?
See, as we grow up, we have wounds that then take care of themselves, so we don't seem to worry much about them. But when we have confounding factors or health limitations, such as, having diabetes or so, these tiny little wounds just don't go away. They seem to be really not so threatening, but they don't seem to go away. So you first try things on your own, then the doctor tries, but the fact is there are specialized programs that are designed to take care of these wounds that are predicted not to close and therefore to be chronic. So the quicker you access these types of specialized care, the better.
So you mentioned 4 weeks. Is that kind of the turning point for you? If you get past this 4-week mark and it's not healing, I mean, what is the timeline between something like that and amputation? I mean, it seems so extreme, but it happens so frequently.
Yes, so first and foremost, regular foot check is an integral component of diabetes care. So if I have diabetes, I should have this thing as, foot care. And how to, cleaning the foot with warm soapy water, trying to see if there's any redness, trying to see if there's any discharge or in disintegrity. Many of the times when you have diabetes, you have less sensation in the foot. So you may have hit a threshold or so and have torn the skin, but you didn't realize that. But if you have this practice of regular foot checkup and you see one of these, I'd say try to find a specialized wound care center where you can see a doctor as soon as possible. Yeah. Now, if something is open for a month, it's already something that should be alarming. But the fact remains that today, if we see the patients that show up at these wound centers often have a wound that are years open. And,
wow.
And perhaps people did not know that there are these specialized wound care centers that they need to access. We have 21 of them in the UPMC system across the Commonwealth, and these are doctors particularly trained to take care of these types of problematic wounds.
So I asked you in the commercial break why Pennsylvania has a higher number of amputations than average, and you said it's really about getting the information out.
That is a big component of of course, managing diabetes is a big national priority and will be, but it does not necessarily explain this occurrence of more amputation in certain states. And I think in many, so the risk of amputation, for example, in a Black American is 4 times.
Wow. Compared
to other ethnic, people of other ethnic backgrounds. So what that tells you is based on socioeconomic strata, based on other considerations, the person with same type of health limitations would have a higher risk. And here, information dissemination, community engagement really plays a big role.
It's interesting and really sad to know that this is happening to so many people. We also know that this impacts quality of life so greatly if you have to have a limb amputated.
Yeah, you see, amputation is not just, amputations are minor amputation or major amputation. Typically, it's below the knee amputation, above the knee amputation. There are all types of classifications of amputation. But amputation does not only affect the patient, it affects the entire family, right, and in many cases the community. In many cases, of course, your mobility is seriously restricted. There is care provider burden. I have been talking to children in amputee families, and they find it very difficult to cope with a parent or a grandma or a grandpa that just came out of the hospital now missing a limb.
Right.
Just the sight of it.
It's alarming.
It is alarming, yes, absolutely.
So tell me, as the new director of the McGowan Institute for Regenerative Medicine, what you hope to accomplish and what you all do there.
First and foremost, McGowan Institute for Regenerative Medicine has been there for over 2 decades, almost quarter of a century. And the first thing that I did after I assumed directorship, in partnership with the chief of plastic surgery, the chair of plastic surgery, Dr. Peter Rubin, Dr. Gail Gordillo, another plastic surgeon, we started the McGowan Wound Research Consortium. The consortium includes 21 specialized wound care centers throughout the Commonwealth. And the beauty of that is you have community penetration. So it's not just the major cities and certain areas that are being covered, but throughout all these communities. So once we have these locations already, as they're functional today in care, the next piece is really to get the word out and to tell people that it's not really such a big deal. It is just for you to seek care,
right?
And it's right there around the corner.
Well, thank you so much. And I think you being here today is helping to get the word out too. Congratulations again on your new title.
Thank you for having me. And I think our success will be measured by the number of amputations going down in the Commonwealth of Pennsylvania. We need combined help of the entire community to make that happen.
Dr. Sen, thank you so much.
Thank you, Heather.
And to learn more about the McGowan Institute for Regenerative Medicine, you can head to our website, kdka.com/talkpittsburgh. We'll be right back.